Normal questions are about hypertrophic scarring and fillers and Botox and pigmentations. According to hypertrophic scarring, because we do not cut all dermis, we penetrate only to the middle part of dermis, there is a very small risk of creation of fibroblasts and myofibroblasts and creating hypertrophic scar or keloid. But if patient is suspicious of keloid healing, of course, this treatment is contraindicated. This is as well in our training manual that if somebody is suspicious of creating of keloid scars, this treatment is contraindicated. But if not, if somebody is not suspicious, there is very, very small risk of creating of a hypertrophic or keloid scar, because normally if you treat with our device correctly, there is very small or no creation of myofibroblasts that are responsible of keloid scarring. According to fillers and Botox, main effect of our device is thermal effect, is coagulation that is based on thermal effect of plasmatic discharge. This means that if you have in a skin molecule that is thermolabile, that is not stable in high temperature, you may destroy this molecule by our plasmatic discharge. So need to be very careful. If patient has in place that you would like to treat has Botox or filler, it is contraindicated to do our treatment. But if you would like to combine treatment with fillers and with Botox, with Jett plasma treatment, it is very easy to do first of all Jett plasma treatment and then to do filler or Botox, and this is completely safe. And according to dark pigmented skin, of as I have mentioned you, we are present in more than 65 countries. It means that we have many experiences, even with the dark or different types of skin than European type. Device is very safe, but definitely if you provide restoration and some coagulation, melanocyte cells are more visible. That's why if you use this device, and it doesn't matter if it is in more pigmented or less pigmented skin, you need to keep UV post-treatment protocol as a prevention of hyperpigmentation. So this was about blepharoplasty treatment, and now I'm going to shortly explain you how to provide treatment with our device in different indications. These different indications are skin imperfections and vascular lesions. What is important is that this is not the most of usage of our device, because you may use even cheaper devices for this type of treatments. But once you have Jett plasmatic vehicle, you may treat as well this type of disorders, of skin disorders. So how to make it with this device? It's very important once we are going to destroy something on body, because our product is medical device, so we may use it in medical indications to destroying skin disorders, and that's why you need to do it in sterile conditions. So you need to do as first disinfection, then put inside local anesthesia, then remove it by coagulation, and then provide again disinfection. Treatment of skin disorders is very easy, and you may use it for first of all scars. You may do shaving of scars. You may shave scars for improving of visage. You may see on left side before and right side after treatment. You may see the improving of visage of scar by the same technology. Same technology means sorry. Same technology means scanning and dotting. So the same technology is used for blepharoplasty used for improving of scars. Because we use direct current. Direct currents means that electric energy, the flowing of electric energy is best in tissues that contains a lot of water. So this means it is very good for hemangiomas, because hemangioma is full of blood and it attracts flowing of electric energy. So once you start to destroy hemangioma with plasmatic discharge, with our plasmatic discharge, direct current discharge, you destroy not only hemangioma, but as well supply vessel inside. So this is important that there is no recurrence of hemangioma if you treat with Jett plasma lift medical. As well, you may use it for removing of fibromas. You just coagulate it and let for spontaneous healing, because our effective spot is very, very small, very, very tiny and very precise. As well, you may use it for very small and very precise areas where you don't want to create collateral damage, but you need to destroy something in a very sensitive area, like in between lashes. Our device do not create any radiation or any hurting radiation like UV radiation and so on. So you do not need to use some shields or covers for eye bulb if you would like to destroy something at the edge of eye, because there is no risk of destroying of cornea or destroying of sclera. That's why you may only put inside small amount of local anesthesia and then destroy it up to the in between lashes. You may see on before and after picture that even on an area where verruca has been present, we have destroyed the verruca, and after complete healing we didn't destroy eyelashes. They are still present in the area. So we destroyed the pathological lesion, but we do not destroy follicles in surrounding of the lesion. So this is really how we do not create collateral damage, because we do not destroy collateral tissue. And another indication that is very, very easy to use by or easy to treat by our device is xanthelasmas. Xanthelasmas are very good to treat because of penetration of plasmatic discharge and penetration of direct current energy and flowing of energy goes direct into the xanthelasma and destroy xanthelasma not only on surface but as well inside. You just treat or coagulate all xanthelasma with our plasmatic discharge and let it for spontaneous healing. Spontaneous healing takes about 14 days, and after 14 days all xanthelasma is going to be healed. Okay, now I'm going to switch presentation and show you how the device really works, and then we will come back for another indication of rejuvenation, because up till now I have explained you the medical type of treatment, and medical type of treatment is based on golden tip, and now I'm going to show you how the device looks like and how the golden tip looks like. So I'm going to stop presentation. And I'm going to show how it works. I would like just to for myself enlarge me. So according to device comes as this. This is all device that you need. This is Jett Plasma Lift Medical. The only thing that you need is connection into electric energy. You may see some important parts. This is the golden tip. Golden tip is removable. If you touch your patient, you may put it into autoclave and put it back. Another one part, very important, is the light electrode. And
Dr. Baran, we do have in chat that they can't see the presentation. I think everyone can see the screen, but at the top of the GoToMeeting, please choose there from the option of see everyone to see who's talking. If you choose this one, you will see Dr. Baran in a larger size at your screen, and you will see it properly. I think this should be the only possibility what could be wrong. So I think we can then go on.
this is the same issue for me because I would like to see myself bigger.
At the top in the middle.
Yeah, I see it. Definitely.
Just click who's talking, and then you should probably see yourself.
Yes, that's it. So in the middle part, in middle up part of line of this. So once again, I continue. The device is like this. This is very important part. This is our touch screen display. Once you connect device into electric energy, you may see the device is on, and you may see there is a tape. This means that there is no connection for patient. You cannot do anything on display now, and you cannot start to treat with device because it's not working. There is electronic fuse. If you would like to start with device, you need to create connection to patient. The connection to patient is based on two possibilities. First, mainly used possibility is this handpiece, contact handpiece. In one hand is patient, and end of this is another part of the device. You connect it. When patient hold the handpiece, the device is on. When the patient is not going to hold the handpiece, there is no work anymore. But once you hold handpiece, you may start fluently to set level of energy up to the level 8, that is maximum, and then you may set play. Oops. And you may see the device now is on. Once the device is on, you may start to treat, and you will see the discharge between the tip and the handpiece. There is a plasmatic discharge between the tip and the handpiece, and this plasmatic discharge works up to ½ centimeter far from the handpiece. Now it works. Once I go far, it doesn't work, and once I go closer, it works. And once I touch the handpiece, nothing is going to happen. And now I'm going to show how the device work in Apple. But for Apple, I cannot use this because Apple doesn't have any hand, so it could not hold in hand. But this is another possibility how you may connect your patient. You may use it with standard ECG pads. Connect our cable to this ECG pad and put it on patient, in this case on, I try to find the correct place, on Apple to make a connection. And another part of connection cable back to device. Now the device is not working because Apple is not grounded. But once I hold Apple, it is grounded because I'm connected to the ground, and I may start to treat with this device. I set level on, and I'm going to show you how to work with the device. First of all, I'm going to show you how the plasmatic discharge looks like. Yes, it's half centimeter far, and we do two part of treatment. First part of treatment is scanning. Scanning means that we do this fast movement for all area. You can easily see that device is on by this light, and as well you may see plasmatic discharge. This is part of scanning, the fast movement for all area. And once you finish scanning, you proceed into another part, and another part is dotting. Dotting means that you create small coagulated spots. You stay about 2 to 3 seconds on one spot, and you create coagulation. It is very easy to use, and it is very handy, because in real time you see what you do, and you see that there is only one plasmatic discharge. So this one plasmatic discharge goes only to one spot, or only to one point, and there is active, and then there creates the vertical shape of burn. And what is very important, that plasmatic discharge is effective only if it is there. So if you do this treatment, plasmatic discharge is active. But once you touch your patient, nothing is going to happen. There is going to be no coagulation on spot, because only plasmatic discharge is active, not flowing of electric energy is active according to coagulation. So if you come closer to the body, plasmatic discharge works, and by this plasmatic discharge you can create coagulation. But once you touch the body, nothing is going to happen. This is very safe in our device. So this is how to use our device with this golden tip, and what is the usage with golden tip. Now I'm going to show you last part of presentation. Last part of presentation is about completely different use. Different use because we are going to change golden tip to our different tips. It's very easy to remove and connect tips that we are going to use now, or are going to show you, and those are silver tips. We've got cone silver tips, 3 millimeters, 5 millimeters, and as well this flat one. You just connect it to device, and now you have changed device from medical use to beautician or esthetician use. And now I'm going to explain you how the beautician type of treatment works, because this is absolutely different than medical coagulation type, because this is completely non-ablative and completely non-invasive treatment. So once we change the head from golden one to silver one, as you can see on right side, we are prepared for non-invasive rejuvenation, and we need one more thing, and one more thing is active gel. Active gel, you may use our Jett serum lift vital, or you may use any of your gel that you are used to use. What is very important is to use gel that is water-based. And once you start to use our device in contact beautician way, it is the way of treatment when you use active gel and you touch the gel with the tip of the device. Once you touch the gel with the tip of the device, because of polarity, as I have explained you at the beginning, that polarity is that device is negative and body is positive. Because of this polarity, once you touch the gel with golden tip, flowing of electric energy is going from the tip of the device to the body, and because of polarity, it attracts active molecules that are penetrating from gel into the body, into the skin. And final effect is a combination of treatment and active molecules. For example, if you would like to improve hydration and improve metabolism, you use active molecules, you use split hyaluronic acid. If you would like to enhance the metabolism, you may use vitamin C or vitamin B inside of the gel. This is a very important part, that the effect consists of two parts of jet plasma, flowing of energy, and active molecules. This treatment is as well very suitable for enhancing treatment of invasive blepharoplasty. Once you treat blepharochalasis with non-invasive blepharoplasty, in time of healing and contraction of the skin, as I have explained you, this contraction, or retraction of the skin takes about 3 or 4 weeks. In this meanwhile time, you may enhance final effect with usage of this silver tips and offer to your patient some more treatment than only non-invasive blepharoplasty. You may improve final visage, and this is another thing that our competitors are not able to do. Once you use device with alternating current, you cannot do this part of treatment that we call electroporation, this beautician type of treatment. How it looks like if you provide only this beautician type of treatment. It is not long lasting, it is only temporarily, but it means for 24, 40 hours. But what you can see is the improving of hydration of the skin. By improving of hydration, improving of metabolism, you improve the visage, the texture of the skin is more smooth, is more hydrated. And you can use it not only on skin that is very thin, but as well for thicker skin, because electroporation has nothing in common with thickness of the skin. Once you have thicker skin, you use active gel, and active molecules are going to penetrate into the skin as well. So you may use it for face, you may use it for example, non-invasive rejuvenation of a neck. So now, thank you so much for watching my presentation and explaining of how our device works. And now there is a time for your question. If you have any questions according to how to use our device, or what are the indications, or anything that you may imagine, just ask us. We are here, me and Martin as well, for your question open.
Yeah, Dr. Werner, thank you very much for your presentation. And now I will open the chat so that we can see the questions, if there are any. Yeah, there came a question: how long does the process take for blepharoplasty?
Proper treatment, as I have shown you on Apple, the dotting, scanning, and the dotting, the proper treatment is quite fast, about 5 minutes for one eye. But you need to count as well the preparing. Preparing means cleaning, disinfection, local anesthesia, connection to patient with device, and so on. So finally, it takes about half an hour up to 45 minutes for both eyes, for upper or lower eyelids. So about 45 minutes, let's say.
Thank you.